My name is Bianca Brijnath, and I am the co-chair of this Dementia Research Action Plan for Australia's CALD communities. And this plan has been developed for the NNIDR and also by the National Aging Research Institute. CALD refers to culturally and linguistically diverse. It refers to the growing portion of Australia's population that were born overseas or who have a parent or grandparent who were born overseas, predominantly from non-English speaking countries.
People from CALD backgrounds have different perceptions and knowledge about dementia. We know that stigma, so negative attitudes, beliefs and feelings about dementia, is probably higher in many CALD communities than in mainstream Australians.
I think for many different people, dementia today means what being mentally ill meant 15, 20 years ago.
Stigma in CALD communities stems from many reasons. First, I think it's quite common to think of dementia as a problem with old age or a mental illness. It's also this feeling that we should protect the person because the symptoms are embarrassing. We don't want to, to shame them, so it can be seen as shameful. And then this misunderstanding, I guess, about how to get help and a feeling that problems should be solved in the family and not publicized in the community. So people don't help seek, and then because they don't help seek, they don't get more information about dementia.
We have got an additional concern, I think, in terms of working together to make sure that we address whole of family issues. So one of the things that I think is going to be really critical for older people, especially the older people with dementia, is how much they can rely on family that of itself is having a crisis.
Most researchers don't report on diversity in the population, which is a problem because it means that we're making clinical and policy decisions without kind of the full evidence base.
The most important thing for us is to accept that dementia really doesn't discriminate.
We noticed a dramatic underrepresentation of CALD communities in dementia research. This is an international phenomenon, not just in Australia, but in the Australian context, we noticed there was a real dearth of work in this space. This troubled us because 1 in 3 older Australians is from a CALD background, and we thought it was insufficient to simply leave such a substantive and growing portion of the community aside. And therefore, we thought it was very important to undertake work to identify the research priorities for these communities. So we consulted with 19 different CALD communities across Australia. And we tried to do this both in major metropolitan cities like Melbourne and Sydney, but also in other places such as Wollongong and Brisbane and Perth and more regional centres as well. So there are actually 21 priorities, but the top 5, which I think we should concentrate on, are around reducing the risk of dementia, so risk reduction, facilitating the development of culture fair tools for dementia screening and diagnosis, identifying ways to improve timely help seeking in CALD communities, designing and trialing culturally specific models of care for CALD communities, and identifying ways to design and to deliver training for the aged care workforce to prepare for an increasingly multicultural and diverse older population that will have a greater prevalence of dementia. Partnerships is first and foremost. Secondly, embrace a spirit of collaboration and co-design. CALD communities themselves often hold answers on how best to engage with them, the needs that they need served, and how to go about doing it. Co-design is crucial. My third tip is that if you in any kind of dementia research, whether it is or isn't targeting CALD communities, you must include variables that address categories of cultural and linguistic diversity. And this is a must for any kind of clinical trial as well as a cohort study.
Use interpreters and translators, and don't be afraid of reaching out to community groups, because almost all the communities, the CALD communities in Australia, are really hungry to partner with us researchers in research. And we've had such a warm welcome in their communities. I feel that other researchers should be reaching out to them also.
Another reason that I think it's critically important that we include people from culturally and linguistically diverse backgrounds in research. It's not just an equity issue. It's not just because we need to address the health inequalities, but it's also a scientific issue. If you're not including 20 to 30% of your population in your research, then you can't claim that it's representative of the broader population.
As a result of the action plan, I would love to see that every provider, aged care provider, are aware of the issue of the CALD community, and everything they're doing, every product, every services that they provide is accessible for people with dementia, to be able to have easy access for them, and also for carers.
As I mentioned, I think working together is a great idea. And the other thing, including those people from diverse backgrounds, so you can see the difference, because each community, as you said, they have different ideas about dementia. So you will have like a better idea about all the communities here. So including people in this research would be a great idea.
So what researchers can do next is we should all read the action plan, we should share it with our networks, we should think deeply about it and try and incorporate some of it into our next grant or research project.
I'm really proud of the research we've done and the work that we've done to get to this point with the action plan. I would strongly encourage dementia researchers and other health researchers to please read the plan, to look at the priorities, and to please think about ways that you can engage with CALD communities and involve them in your research.
So we at the National Ageing Research Institute, together with our colleagues at NNIDR, have worked very hard to make sure that we include voices of all the key stakeholders in putting together this action plan and developing the priorities. So I commend it to you to read, to share with your networks, and most importantly, to implement the recommendations.
So to the communities out there who are interested in CALD dementia research, please read the action plan. It's been translated into 6 languages. Then contact us researchers. We'd love to work with you on one of these projects.
虽然失智症让你觉得很无助、很无奈，但是你并不孤独。这个计划能协助你度过这个难关。记得，你并不是一个人面对这个失智，你并不孤独。
للحصول على معلومات أكثر باللغة العربية عن مرض الزهايمر يرجى الضغط على الرابط في الفيديو وشكرا.
It is okay, it is all right to feel angry, to feel lonely, to feel stressed. But it's okay, but you are not alone. We are there together and we will be able to support each other through the strength of the community.